This lotion is used to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations. It helps to soften and moisturize the skin and decrease itching and flaking. Some ingredients are used to protect the skin against irritation, like from wetness. Dry skin is caused by a loss of water in the upper layer of the skin. This lotion works by forming an oily layer on the top of the skin that traps water in the skin. It also draws water into the outer layer of the skin. Many products also have ingredients that soften the top layer of skin cells and help the dead skin cells fall off, leaving the skin feeling smoother and softer. This product should be used as directed. Some products may need to be shaken before use, so be sure to check the label. You can apply the lotion to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. If you're using it for dry hands, you may need to use it every time you wash your hands. If you're using this product for diaper rash, make sure to clean the area well before applying the lotion. And if you're using it for radiation skin burns, check with radiation personnel before using it. It's important to follow all the directions on the label for proper use and to apply it only to the skin. Avoid sensitive areas and areas of broken, chapped, or irritated skin, unless directed by your doctor or the label. Using it regularly and applying it to damp skin will help you get the most benefit from it. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help right away. Some people may experience burning, stinging, redness, or irritation when using this lotion. If these effects last or get worse, make sure to inform your doctor or pharmacist. If your doctor prescribed this lotion, they have determined that the benefits outweigh the potential side effects. Most people using this lotion do not experience serious side effects. Contact your doctor immediately if you notice any unusual changes in your skin, signs of a skin infection, or symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so make sure to contact your doctor or pharmacist if you notice any other effects not mentioned. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this product, make sure to tell your doctor or pharmacist if you have any allergies. This product may contain ingredients that could cause allergic reactions or other problems. If you have skin cuts, infections, or sores, it's important to consult your doctor or pharmacist before using this product. Certain ingredients in this product, like preservatives and fragrance, may make your skin more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take special precautions when you're outdoors. It's also important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing. If you get sunburned or experience skin blisters or redness, contact your doctor right away. Some products may make acne worse, so if you're prone to breakouts, look for the word non-comedogenic on the label. Certain products may also stain or discolor clothing, so be sure to ask your doctor or pharmacist for more details. Before having surgery, it's important to let your doctor or dentist know about all the products you're using, including prescription drugs, non-prescription drugs, and herbal products. If you're pregnant, be sure to tell your doctor before using this product. And if you're breastfeeding, consult your doctor before using this product, especially if you're applying it to the breast area. It's important to be aware of potential drug interactions when using daily moisturizing lotion 1.25% topical skin protectants. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. If this lotion is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, call for emergency help. Otherwise, contact a poison control center immediately. Residents in the U.S. can reach out to their local poison control center at 1-800-222-1222, and those in Canada can call a provincial poison control center. To help prevent dry skin, you can use lukewarm water instead of hot water when bathing, take baths or showers less often, keep baths or showers short, and use a humidifier when the air is very dry. There are various types of emollient products available, including those with fragrance or other ingredients that some people may be sensitive to. Emollients come in different forms such as oils, creams, lotions, or sprays. It's important to consult with your doctor or pharmacist to find the best product for you. If you use this lotion regularly and forget to apply it one day, just apply it as soon as you remember. But don't use extra or apply it more often than directed to make up for the missed dose. Make sure to check the storage information on the package, and if you have any questions, ask your pharmacist. Keep all medications away from children and pets. Avoid storing the foam canister near high heat or open flames, and do not puncture or burn it due to the pressure inside. Do not flush medications down the toilet or pour them into a drain unless instructed. Properly dispose of the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.